Good morning. It's my pleasure to welcome you all back for episode 9 of the coronavirus COVID-19 update. And I'm delighted that we have really an eminent researcher, scholar, medical professional, and somebody who's very well known here in Hong Kong as well as globally, Professor Gabriel Leung, Dean of Medicine, Chair Professor of Public Health Medicine at the University of Hong Kong, and also the founding co-director of Hong Kong U's WHO Collaborating Center for Infectious Disease Epidemiology and Control. So before we get to Professor Leung, just a quick summary of what's happening since the last 24 hours, since the episode 8. We have officially hit the million mark as of yesterday. So 1 million infected cases of COVID-19 globally. And also here in Hong Kong, yesterday, the decision by the government to close the 1,200 bars and pubs effective today for a 2-week period. And also, I understand we also have hit over 800 in the numbers here in Hong Kong in terms of effective cases. We went from about 100, a little over 100 maybe about a month ago, and now to 800. So those are the current situation as of today. So we will now turn it over to Professor Leung, who is a veteran. I mean, he has been involved in this COVID-19 from day one, and also for the last almost 17 years in terms of SARS and so on. But I want to ask Professor Leung to start off to talk about from his perspective, the COVID-19 as of today, what are some of the things that he's seeing or have seen? So, Professor Leung?
I think let's just begin at home in Hong Kong. Hong Kong hasn't really had a first wave of locally sustained epidemic yet, and may that long continue. Why I say that is because we've had 3 phases of importations. So the very first phase of importation was from the middle of January to probably just after the Lunar New Year. Those few weeks, we had importations from mostly mainland China. Then we had a second phase of importation mostly from the Diamond Princess cruise liner. And then now we're in the third phase of importation, and which is our largest wave of importation, mostly consisting of overseas returnees, and the main bulk of them are actually Hong Kong students studying abroad, whether it's in boarding schools in the US and the UK, or a lot of university or college students. Now, that's why we've had 3 phases of importation, but for the first couple of phases of importation, because of what we've been doing and what we have implemented and the collective goodwill, really, the social consent and the adherence of the local population, we have been able to suppress the potential of a locally sustained outbreak. We're now in the middle of the third phase of that importation, and quite frankly, it's a little bit scary because of the sheer volume of students who have returned in the last 2 to 3 weeks. And we're looking at, or we were looking at 6,000-7,000 per day in terms of inbound passengers at the airport. Now it's down to about 2,000+. So the number has been drastically reduced. But we're still in the middle of that. Now, I suppose, slightly optimistic and promising or reassuring news is that if you actually track the local transmissibility, that is the ability to spread, we are still a little bit above or a little bit below the self-sustaining threshold. And so we're still doing okay. And as you can see, over the last week to 10 days, government has imposed a series of progressively restrictive measures in terms of physical distancing. whether it's closing down establishments like bars, pubs, requiring only 50% maximum capacity of restaurants, or really trying to keep people away from congregating, so limiting congregations to no more than 4 people. So this whole series of measures have probably, or are probably starting to help us really deal with this flux of imported cases. It seems to be working okay so far, but we're not out of the woods yet. It would take us another week, maybe 2, to really see us through this critical period. And then maybe we get a tiny bit of a breather until the next phase. But Hong Kong has been doing fine so far, but it is not free. The cost comes in 2 places. The economy. Hong Kong has released data of retail sales 48 hours ago that has shown the largest dive, really, in the past quarter of a century. And also, it's the collective goodwill of the Hong Kong people that implied or expressed social consent and emotional well-being of really sort of shutting yourself off at home. Physical distancing, while we don't at all want people to be socially dislocated, but it does have that effect. And so those are the costs, and it's always a 3-way tension, or if you will, a 3-way tug of war between health protection, economic preservation, and social well-being. So these will be at the core of all government's decisions from now till this thing settles down. And I'm afraid it's a bit of a marathon.
So this leads to a question that I have is I clearly identify these 3 sectors, but right now I think for me it's having kind of seen this last 8 weeks. It's kind of frustrating as a general public, but what can we do? Okay, first of all, the business community, the general public, and we know what the health professionals are doing really a yeoman's job in terms of dealing with, but advice to just the general public as well as the business community in terms of the public-private partnership. Is there stuff that we can do? Maybe it is kind of really abiding by what the government has kind of cited, but
okay. So 2 things for businesses. Obviously, this is a very, very, very bad time, and you see these unemployment figures coming out from the U.S. in the last 12 hours. That really, really scares people. And when you look at not just GDP drop, but actually unemployment rates soaring and underemployment rates soaring, and particularly affecting the more fragile parts of the population, so the already disadvantaged groups. So that's very worrying. And business owners, obviously, they have a cost of capital. And when you tie up that capital with the economy basically coming to a complete standstill, it is not easy for them. But that said, one has to realize that even just from a business point of view, your bottom line is going to be better off if you adhere and comply now with what you may feel as draconian, drastic measures, because the counterfactual alternative is much worse. So if you just allow that epidemic curve or that effective reproductive number curve to rise, it's quite easy to let it rise because you just need to step half a step back. That will just exponentially grow. And while it's easy to let go, to try and bring it down to some reasonable level, and by reasonable, I don't mean 0 cases, 0 deaths. Reasonable means that your healthcare system does not implode on its own weight, like you are seeing in London, in New York City, in northern Italy, in the Lombardy region earlier on, and in Spain. So those are pictures that you don't want to see in your own local situation. And so if you want to bring that down, the pain and the time would be multiples of what it takes to just keep it low in the first place. So it's really just out of self-interest that businesses should do the right thing, let alone corporate social responsibility, ethics, or humanitarianism. And having said that, I think that there are things that government can and should do. Keynes is coming back into fashion, very much fashionable. And so governments can and should, quite frankly, number one, protect the livelihood, the bare necessities to just go on of workers, especially underprivileged classes. So people who are on hourly wages, people whose jobs are the most vulnerable, the people who are dishwashers in restaurants, people who are waiters and waitresses in restaurants, people who are working in the tourism industry. These are all gone. They've gone down by 99.9%. So these people's livelihoods and their families must be guaranteed at some minimum level by government. And then in a place like Hong Kong, and indeed any other big metropolitan areas where rents are very high, then it has to be some sort of shared responsibility between government, but also the big corporates. SMEs can't and don't have that cash flow capacity, that cushion, to deal with this. But big corporates, like governments, do. And I think that this is the time for them to recall what the people collectively, via government, did for them back 10 years ago. And I think that this is much worse economically compared to 10 years ago. And think of what the whole world did to bail out big corporates and Wall Street and the equivalent. This is your time to help the rest of the world.
Thank you for those the wisdom. I really appreciate that. So now let's turn back to in terms of what's happening in China, because this virus started in December. Was the first time I think a lot of people heard about it. And yesterday, I think in the press, Professor Zhong Nanshan said COVID-19 could be under control by end of April. And is that, in terms of what's happening in China right now, we're hearing the lifting. I think Hubei, Wuhan is going to be, I guess the confinement is going to be lifted around the 8th or so. But there are still pockets of like counties in Henan that is being locked down and all that. So how do you think Hong Kong will be affected? We're really close. And I'm really surprised at our number. In terms of considering how close we are physically to China, but our number has been relatively low. So can you talk a bit about that alignment, that coordination with, and also from your perspective, when you first heard of it until now, in terms of the Hong Kong-China coordination or on this COVID-19?
Well, I'm sorry, I missed the interview you mentioned yesterday, but I am a man of science, and let me just explain the biology. The biology is such that COVID-19 is caused by the bug now called SARS-CoV-2. This bug is never been seen before in human populations, and therefore 0% of any of us have any immunity to it. Okay? It has proved itself to be highly infectious. On average, a typically infectious person would go on and spread it to 2 or 2.5 more people. And therefore, the first generation would be one person, then you get 2 or 2.5. Then the next generation after that, you get 2.5 of 2.5, and so on and so forth. So it's actually, by definition, an exponential growth. Third, this, quite unlike SARS, spreads quite easily even before the infected person show any symptoms. And that is the remarkable feature of this particular coronavirus. In fact, about 40% of all infections were caused by infective people spreading it during the incubation period. That is when they have got no clear or overt symptoms. That is why it's so difficult to prevent and control. Now, given all that, and these are biological facts, these are immutable, and it is pervasive across the whole globe. So given that, then you would say, well, is warmer weather going to give us some respite? The answer is maybe, but probably not. Okay? And the reason is this. Whether a bug spreads efficiently depends, yes, on seasonality or the weather, humidity, temperature, and mostly probably absolute humidity rather than relative humidity. If you look at some of the stunning work done by people in New York, Jeff Shaman and colleagues with my colleague Mark Lipsitch from Harvard, who was on this program just a week ago. So it's the interplay of population immunity and absolute humidity and temperature and so on. During the first, and maybe even the second wave of any new, completely novel pathogen, it's probably the population lack of immunity, that is, there are a lot of susceptible people out there, that has the upper hand. But as you get more and more waves, then you deplete the susceptible pool of people because they have actually been infected, and most of them have recovered and have immunity. And therefore, as you go to the second, maybe the third wave, then seasonality or seasonal forcing would kick in and actually have a larger effect. So I agree that probably for the Northern Hemisphere at least, probably the summer months are going to give us a little bit of a breather. But that is not because it is a summer. It is because most of the most susceptible people have already been exposed and either have been infected, a small proportion have died as a result, but the vast majority have recovered. And therefore, maybe that's the reason why we're going to see a little bit of a respite or breather. But until and unless about half of the world's population has got immunity, this is not going to settle down yet. There's very little biological reason why it would, okay? So most of the epidemiologists around the world are saying very much the same thing. Now, how do you get immunity? There are only two ways. One is through natural infection and recovery. And two is through passive immunization, i.e. getting vaccinated. A vaccine is not going to be available by the summer. It may have small quantities starting to come online, with a bit of luck, by the end of the year, early next year. But probably we're looking at least a year before sufficient numbers of people around the world have access to an effective vaccine. So that is why I say that this is a bit of a marathon. We are probably going to go into a few cycles of really suppressing the virus by very, very heavy-handed measures, if necessary, and then lifting them as we see a lull, and then resuppressing. And so this kind of suppression and lift waveform is going to follow for the next few months at least.
I want to now touch upon the elderly. You mentioned in an interview recently with SCMP the risk of death among those who are over 70. It would be about 3 times more than the overall death rate, about 1.4. So can you talk about, I think the age stratifies susceptibility
Yes.
and why it's important to focus on some of the policy prioritizing the elderly?
It is very clear that the older folks are probably more susceptible, but definitely much more likely to die compared to younger people if they get infected. Group after group around the world have confirmed those findings. We published our findings in Nature Medicine. The Imperial Group published theirs in Lancet Infectious Diseases, and then there are now a couple more that have come out really saying the same thing. So this is robust, and this is real, and this is actually also confirmed by clinical observations at the bedside, the world over. So that is why it is so important that we protect vulnerable groups, and by vulnerable we mean older folks, older adults, and particularly those who are institutionalized in nursing homes and care and attention facilities. Now, once you put those two very high-risk things together, older people living in an institution or a facility, then it can become absolutely catastrophic. And that is why we must do everything that we possibly can to protect these vulnerable groups in society. And that's really why we are so strong on this particular point.
You also were quoted, kind of maybe lightheartedly, but keep calm, stay sane, and carry on. But again, I feel in this last 8-10 weeks, it's really hard to continue that. So your advice to here in Hong Kong, in fact, we're 2 or 3 months ahead of the world in terms of this seeing COVID-19. So how do you advise now, first Hong Kong, and then the rest of the world in terms of how do we stay calm? And one of the things that you also mentioned, which this the physical distancing rather than the social distancing, which I think that's a really good clarification. And your colleague, when we interviewed Professor Fukuda here, talking about the importance of social cohesion. So can you kind of touch a bit upon that? I feel I'm your average person. If I'm feeling frustrated right now, I think a lot of my friends are also feeling quite frustrated. So your professional advice in terms of how do we stay calm in this midst of this something we've never seen before. It's kind of like our version of the Spanish flu, right? So, yeah, so.
I think it's very difficult. I think that we have to acknowledge that it's really tough. It's really tough. The difference between us and 1918 Spanish flu is really that we have mobile devices. We have Facebook Live broadcasts. We've got Periscope music. We've got Spotify. We've got FaceTime. We've got tools that enable us to stay together while being physically distant. Now, of course, there is nothing that will replace a hug. There is nothing that will replace the sense of touch. There is nothing that will replace the live experience of hearing your loved ones laugh. But we are already much better off than in the last century, really. We're much better off than when we were during SARS. And that's really something that we have to cherish, make the best use of. And, you know, I have never ceased to be amazed by the creativity, the innovative spirit, and that resilience of people all over the world. Every day I get sent these YouTube videos or video clips, whole families coming together and singing and, rewriting the lyrics to very, very well-known tunes, doing gigs online for people. And, I was so touched when yesterday I got this on my WhatsApp. It's a picture of the Last Supper. Of course, I still remember looking and admiring at that mural in Milan, which of course is in the middle of this outbreak, and bless the people in Lombardy. But, you know, it shows that Jesus was the only one in the middle of the table, and all the disciples were apparently arranged as if they were on Zoom. So, you know, just hang in there. It's going to be a marathon, but it's a marathon because you and I have done our parts. It can become a sprint, but that will mean a lot of people will unnecessarily die. And you would bring absolute devastation, health-wise, economy-wise, and social and emotional well-being-wise, if it is a sprint. So let me just try to address this paradox. It will become a sprint if you just do nothing and allow this to sweep through the whole world. But as I said, it's absolute doomsday scenario, and you don't want to do that. But yes, it would be over quite quickly. But it will be a marathon, and it can only be a marathon if we are successful. If we are successful at holding this infection from spreading like wildfire, but instead aiming for a very low-level controlled, I don't like the word burn, but a controlled spread, because you can't stop it completely, then you would minimize this catastrophe, and also you may be able to then go on with as much normality as the circumstances would allow you. So we shouldn't see this marathon as a drag or as something that is wrong or not good. It is actually a reflection of our collective goodwill and success. But as with every marathon, as soon as you get to about a third of the way through, you think, oh, where is the ending, where is the ending, where is the ending? And it gets tough. And it gets tough mostly not because of muscle cramps, but because of that emotional resilience. And that is what we need to be there for each other.
Thank you for that. I have to say I'm more reassured after hearing your word. Having never done a marathon and having thought about it, but I think your analogy is very apropos for what we're going through together. It is a journey we all have to, whether we're in Hong Kong or in Australia, in Italy. So thank you for that. But then you also talk about technology. It's great that we can now communicate directly, and this is really the purpose of this coronavirus update since we started in February. In fact, it was very much inspired, I think, by one of the, I think Hong Kong you and your colleague were one of the first. I remember seeing it online, and it was really wonderful to hear the assurance in some of the facts, science, using the facts. And one of the reasons we're doing it, Asia Society Hong Kong, unlike Hong Kong U, we see ourselves an educational institution. My fear was the information I was getting from WhatsApp that were, some of it was fake news. Again, not knowing what is real, what's not real.
A lot of it is fake news.
Correct. And so this is one of the reasons we thought, let's start our coronavirus update speaking directly to a professional, to medical professional directly. So I wanted to kind of touch upon the Fight COVID-19 Hong Kong U website, the importance of it. It's like, can you talk about, it was established, your first webcast probably was around also early February.
No,
in terms
our first press live conference was, I think, the third week of January. We were trying to really figure out what's going on. We were trying to work out together with the mainland, as well as friends and colleagues all over the world, trying to figure out what is the likely size of the epidemic in Wuhan at that point, and the potential for actually spreading to the rest of the country as a result of Chunyun, the Spring Festival-related travel season, that mass migration every year lasting 40 days, and then by extension, what may the rest of the world be looking at. So that's really when we started. And it has been 24/7 nonstop since. It's now, 2.5 months?
Yes,
3
and
months.
last night I stayed up and watched 9 o'clock last night. Professor Yuan, your colleague, on Facebook Live.
Yes.
Also, that again, information directly from the source to me is very reassuring. So I wanted to thank Hong Kong U for that, and I think those information can be available online. So I definitely recommend people. Sometime if you're kind of depressed, to log in to just, I think facts help address some of the uncertainties. And that's another thing that I feel, an average layman, certainty in this time of uncertainty is
Yes,
quite...
but also actually living with uncertainty. Scientists, and in fact, the better the scientists, the less certain they will be in their pronouncements, because science, by its very nature, is tentative. Science, or the state of the science, is only as good as your next experiment. Remember that. The whole point of science is that we try through experiments of all sorts, whether it's chemical experiments, biological experiments, mathematical experiments, epidemiological experiments, experiment by experiment to try and disprove that frontier state of knowledge. And by the repeated and iterative process of disproving the immediate past state of the science, we push that frontier forward. So every time you hear something, you have to be able to live with a bit of imperfection of that particular method, a bit of uncertainty, but rest assured that good scientists are working and have been working 24/7 to protect all of us. And I think that the real heroes are the people at the front lines, whether it's in the hospital wards, in the labs, in the digital labs, or the cleaner who keeps us all safe by keeping our hygiene and keeping things on an even keel. So everybody is on the front line. The postman is on the front line. You are on the front line. The people who are just staying home is on the front line, because it is no less emotionally taxing for a working mom who has to work at home and manage 3 kids who otherwise would go to school for 8 hours a day. So to do this day in and day out, everybody is in the front line, including you, who may be watching right now. And so just give yourselves a pat on the back and just say, look, let's all work together on our own front lines, in our own trenches. We will see the light of day very soon, but not quite yet.
Thank you for that encouraging words. And now I'm going to turn to the questions from the online audience. And it's always interesting to hear directly from the public. This question is asking, if a symptomatic person with the virus wears a mask, can he get worse because of the increased viral load, rebreathing his own virus-laden air?
No. Very simple answer.
Great. Okay, let's talk about the mask. Seems to me there is a turning point because used to be, I think when we started the program, in February, when talking to Professor Cowling, in fact, Professor Cowling, what he was saying was save the mask for when we really need it in a few months' time. And save it for the medical professionals who, at that time, remember Hong Kong, we had mask runs and so on and so forth. So now it seems to me, and then in the West kind of dismissed it. Again, similar arguments that masks, save it for the medical professionals, and also culturally, East here in Hong Kong and Japan, we're used to wearing masks and so on, whereas the West, we don't need it. But it seems to me there is this turning point right now in terms of wearing masks. And even yesterday, I was talking to Dr. Hui, and also I'm seeing online the idea of cloth mask. It's better than nothing. So, you're wearing a mask today, and I can't speak with a mask on. So talk about the mask in your from your perspective in terms of, and right now in Hong Kong, we seem to have, we're not running out. We're not doing the run, but it seems to me I'm actually sending some masks to my colleagues in other parts of the world. So, talk about, as a layman, mask, no mask.
Well, let me just say this. I think we have to be very clear about the scientific basis of face mask as a protective measure. Then there is the practicality of production and distribution of masks. These two may or may not converge, okay? I think that especially in this day and age where everything is highly transparent, one shouldn't make decisions for others by conflating two sets of facts. So the first set of facts, as I said, science evolves. Nobody had been very interested in seasonal coronaviruses because they give us a common cold, they don't actually make you too sick, and that's why there isn't even a vaccine for it. But as the state of science has moved very quickly in the last 3 months, we now begin to understand, number one, if you wear a mask, what you are actually doing most of all is if you yourself is infected already, and remember, 40% of infected people would pass it on successfully to others when they have no symptoms, no overt symptoms. So if you were already infected, especially if you have symptoms, but even when you don't have symptoms, you are actually protecting others around you. So that's number one. That we know is very clear. What we don't quite know is, for sure, do we get protection ourselves by wearing the mask? Okay? Logic or common sense would tell you that you do get some protection at least because there is a barrier, there's a physical barrier. But unless you wear a N95 respirator, the leaks around the edges may or may not be sufficient to protect you, okay? So then there is the third line of evidence, and that is aerodynamic evidence. So most recently, MIT came up with a study that said, look, the plumes that you actually generate in everyday activities, whether it's eating or speaking, not even coughing and sneezing, may be able to, depending on the conditions of the room that you're in, may actually be able to spread it for meters, up to 8 meters away, all right? And therefore, the experimental evidence, not direct in vivo experiments, but experimental evidence looking at aerodynamics shows you the potential as well. So the precautionary principle then, the state of the science, should probably be something like, well, if we adopt the public health precautionary principle and everything else being equal, then probably wearing a mask is a good idea, all right? Especially in very crowded places, on public transport, and if you do it universally, it probably does more good than harm. That's the science. The production and distribution question is, we know that this world has got 7.5 billion people. If you, on average, even use just one mask a day, you need to have a worldwide production capacity of 7.5 billion. We don't. And in fact, if you look at just news pictures from even the richest places on earth, New York, London, they don't even have enough masks for hospital workers. So that is the production and distribution bottleneck. And we must address that. And therefore, if we have to ration, and it's a very bad word, but it's an honest admission of the truth in some places, especially those hardest hit right now, it is rationing, even for hospital workers. So can we and should we recommend everybody else who are at obviously much lower relative risk than the hospital setting to use some of the masks which should go to those most in need? So that's a different question, all right? And the clear answer there would be no, you should save it for the people who most need it first. So I think that there is a divergence in the two main pillars of consideration. And when you conflate it together and then try and say, well, we know best, and that's why we've come up with this recommendation, having looked at the totality of the considerations, I think that's where some of the confusion and some of the unhappiness comes from. People will say, look, I can accept it if you explain to me the science and explain to me the bottlenecks, and I may come up with the same answer as you're recommending, but please don't conflate the two and then tell me and expect me to follow, because in this day and age, everybody can access this kind of information quite freely.
This also from the audience, online audience. Given the variations that some people get sick and others are asymptomatic, are there research studies on whether this is linked to a particular gene mutations?
No, it's probably host response. It's nothing to do with the predominating clades, and there are 3 large clades that have emerged, but there is absolutely no evidence to show that these clades have any differences in phenotype. That is, they don't behave differently in terms of infectiousness, severity, and really the differences that you see are probably what we as human hosts to that virus actually is how we respond, not because of the different clades that we get infected by or with.
And this is also related to asymptomatic. How long can asymptomatic infected individual be contagious for? Is 4 weeks a good estimate?
Nobody knows is the real answer. And I think that we have to clarify 2 concepts. Are you talking about truly asymptomatic, that is people who get infected but never show symptoms from infection to recovery? Or are you talking about people who do not yet show symptoms but will go on and develop symptoms themselves? That is, people who are in the incubation period. Those are 2 very different types of people. And that's why, again, the face mask makes sense, especially when you're talking about asymptomatic spread or pre-symptomatic spread.
This particular question is about how effective is wearing a cloth mask?
Well, there is a reason why we don't wear cloth masks in hospitals, at least not since 1918. It's because the 3-ply mask, the middle layer actually is special material. All right, it is a filter, and that is why we say, hey, for these disposable masks, if it gets wet, then that filtering process doesn't work properly, and it doesn't really protect you. So cloth masks are obviously probably not as good as a disposable, properly formulated mask, but are they better than nothing? Common sense would tell you that yes, they're better than nothing, and in fact, they were what hospital surgeons wore before we had disposable face masks. So I think that we have to be, accommodating if we really have nothing, and if cloth masks, especially multiply cloth masks, are available, then yes, that will have to do given the circumstances until you get that production and distribution bottleneck sorted.
Here, the question was, some experts are saying that given the TB and BCG vaccination could have some kind of immunity to COVID-19. Is this correct?
It's probably immunomodulatory, but we don't know. I mean, some preliminary papers are coming out to claim that prior vaccination with BCG may give you some protection. We really don't know. And in places like Hong Kong, you will never find out because everybody has had BCG. So you would need to have much more careful study. But, there are two types of science. One is blue sky science, which I think this is, and the other is immediately applicable science. Because if you think 3 steps ahead, are you then going to mass vaccinate with BCG in otherwise naive populations? So I think that we have to be realistic, and rather than looking at a TB vaccine that is very old and may or may not work, why don't we just focus efforts on producing enough effective and safe vaccine against COVID-19 directly?
Here's a question about SARS. How did SARS disappear quite quickly back then compared to right now, COVID-19, I guess?
Well, SARS, as I said, has got a very different viral shedding profile and therefore, by extension, infectiousness profile. SARS only spreads most efficiently about a week, even 10 days after you first show symptoms. And therefore, if anywhere or any time during that first week of symptoms, you immediately identify the people and isolate them in hospital and treat them, then you remove them as an infector in the community, and that's how you control it. Here, 40% of all infections take place during the incubation period of the index case. You can't use the same measures, and you can't identify the people while they are spreading, and that is why it is so much more difficult.
Here, the question was, would you recommend government to have a full closure of all borders in the near future? And also any advice to Hong Kongers who still have, whom still travel for leisure in the near future? Are we going to be able to travel anytime soon?
Well, I wouldn't travel for leisure at all because, number one, it's very difficult for you to try and travel for leisure because border restrictions are in place in many countries, although I note that they are still possible, evidently, because Hong Kong government is, as we speak, arranging flights for some people to come back from Peru. But I would not at all recommend traveling for leisure until there is some resolution to COVID-19 pandemic. Nevertheless, you have to acknowledge that there are instances, however rare, of absolutely necessary travel, and some of it may even have to do directly with fighting COVID-19. So in terms of whether we should close our borders completely, I think that we have to realize that there are generally 3 things that we can and should do as any government, anywhere, fight a pandemic. One is border restrictions or border controls, okay? 2 is quarantine and isolation. That is the test, trace, and treat strategy. Lastly, it's social distancing. Okay, restricting the number of people who congregate, closing down bars, perhaps even restaurants. And I think that these 3 are the pillars. Obviously, the most disruptive is actually social distancing because everybody in the population has to do it and has to abide by it. And that is the most disruptive socially, and it hurts the most in terms of emotional well-being and the economy. So if we want to let go a little bit on the social distancing, we have to beef up on the testing capacity, the contact tracing capacity, and then making sure that you have treatment capacity in your hospitals, that it doesn't implode on its own sheer weight. And, of course, border restrictions have to be very targeted. And it also depends on your own epidemic trajectory, the people who you are deciding whether or not to let in or out. So I think that it's very dynamic, and you have to really just ground all these decisions in the science at the time, because it changes on a weekly, if not daily basis.
That's so true. Right now, one of the questions that we have, and it was particularly my colleagues here with children who have been stuck at home since Chinese New Year holiday. And you mentioned before, children appear to be just as susceptible as adults, according to some of the studies, but that the children doesn't seem to fall as seriously ill. But right now, one of the questions I have yesterday was about school closing, and Professor Wei said it's going to probably be till the end of the year. So in terms of school closing, Singapore has adopted a very different policy, but right now it seems to me the rest of the world, school closing is indefinite. So for here in Hong Kong, what is your thought on that? Are we going to be, the school's going to close? Your recommendation about that?
Okay, as I said, I'm a man of science, so I don't like speculation. Let me just give you the state of the science. The state of the science is we don't really know whether children are as susceptible and as infective or infectious as adults. Early studies from Shenzhen done by the Johns Hopkins team seem to suggest that children are just as susceptible. Now, more recent studies are starting to question that and possibly suggesting children are a little less susceptible. We still don't have good, reliable estimates or analyses that would give weight more to one side or another. So we're still actually looking at that question. Even my own team is struggling with that question and doing the analysis right now. Now, then the second question is, are they more infectious, less infectious, or equally infectious compared to adults? Now, for influenza, we know that children are much more infectious than older folks. And therefore, we close schools when we have very, very high influenza seasons. Now, here, we don't know yet. And what we need to know is, number one, better, more detailed and technical nuances in the epidemiological analysis, but also we are waiting for serological evidence from places which had already undergone the first wave. Neither of these are currently available yet. And that's why this school closure question is still a big question mark. But the precautionary principle has actually given government sort of that lean or that weight to say, look, okay, we should close them just in case. Now, many people have said, look, Singapore didn't close schools and they don't seem to be doing too badly. I agree. And that is why it is a big question mark. But please also remember that Singapore has hit the 1,000 case count as of yesterday. And we are at just above 800. So Singapore is 25% higher than Hong Kong in terms of the absolute number, with 1/3 fewer people. So on a per capita basis, Hong Kong has actually done even better by a fairly sizable margin. So I don't know whether that delta can be attributed to universal masking or school closures or both or something else. I just don't know. And I think that we have to be brave enough to say we don't know when we don't know rather than speculate.
Well, it seems to me there's going to be a lot of studies afterward, kind of like now we know so much about SARS 17 years later, the lessons learned. So I'm looking forward to, a year from now or from, learning some of the lessons. Globally, looking at the global picture, everybody seems to be doing things very differently. But it's what I find interesting is Hong Kong, we were ahead of the curve. And because we have some experiences from SARS, a lot of experiences from SARS. So I want to ask you personally, though, from you were here during SARS, very much on the front line. Lessons you have learned from SARS that are helping you now tackling this crisis?
I think, mostly is to do with the mindset. And the mindset would lead you to be more agile, to be more flexible, and to be open. And, having done this for 20 years, you learn to be humbled by the bug, the biology of the bug, the population response, and you would learn to respect that there is stochasticity. That is, you have things that you can't control. Either it's because it's nature or because it's social behavior or human behavior, and that you just have to keep at it and believe in science and believe in doing the best you can given circumstances. And I think that belief and that emotional resilience is really what has kept my colleagues and I going.
Well, I want to really pay a tribute to you and your colleagues. You guys definitely, in fact, I was mentioning this yesterday, really the healthcare workers and professionals like yourself really are the superheroes. I think sometimes we look at politicians, I think in terms of debates and the uncertainties that we see from some of the political realms, but in terms of what assure me today, really what you have talked about, the science of it. And yes, there is a lot of uncertainty still, but you're tackling it. You're working professionally and, seeking the truth to kind of get us out of this current situation. So I want to end by, these are the questions, a lot of the question is asking about treatment. Do you have any update on treatment of COVID-19? One particular question was asking about the
hydroxychloroquine.
Yes, and other convalescent plasma as potential therapeutic. So can we end on some of that?
Sure, we know that
treatment.
Not just for this bug, convalescent plasma obviously is something that, especially for as a last resort, we always turn to. But the biggest problem is actually scaling it. Okay. And there are other drugs that have been mentioned, a new drug called remdesivir, which is undergoing trials, chloroquine as probably an immunomodulatory agent rather than as a direct antiviral. Things like the combination HIV therapy, the commercial name is Kaletra, and interferon beta, ribavirin. I mean, there are a whole number of drugs that are undergoing trials at the moment. There are hundreds, literally hundreds of trials going on all over the world. But none have been definitive yet. There is no dedicated antiviral against COVID-19. And so I think that we have to realize and put things in perspective. COVID-19, while scary, doesn't kill in the vast majority of people. The case fatality risk is probably amongst people who show some symptoms, probably around 1 to 1.5%. And amongst everybody who gets infected, it's probably a fraction of a percent. So that means that more than 99% of people who ever get infected will recover. So that's the good news. The bad news is, of everybody who shows symptoms and then get admitted, 5% needs to go into the ICU. Another 10% show serious or severe symptoms requiring quite a lot of therapy by our frontline staff. But the rest actually showed mild or at most moderate symptoms, and almost they recover by themselves with minimal intervention. And that is why we have to keep things in perspective. Having said all that, statistics is not very much use or very reassuring for the individual. Statistics applied to 100 people to 100 million people, you get percentages. Statistics applied to one person, it's either you get sick, you die, or you don't. So that is the difference between spreadsheets and actually the one-on-one relationship a doctor or nurse has with the patient. And so we have to realize that everybody is different, everybody is precious. We will do everything possible to protect everyone. And with that, I just hope that people will understand, will empathize, and will continue supporting the women and men who are in the hospitals, who are staying at home. Whatever you're doing, you're all at the front line, and you are all superheroes.
Thank you. Thank you, Professor Leung, on that note. We were really grateful for, I know how busy you've been, and to take time from your busy schedule to be with us and give us a lot of food for thought. And thank you for your wonderful work, and we're all behind you. But, I wanted to end this update with a personal note. It was about a week ago that we received a letter from HAB considering asking us to close the center for the 14 days, and we immediately comply. And we received notes from people thinking that maybe we had COVID-19 cases here at Asia Society Hong Kong. I can assure you, as far as I know, none of my colleagues, none of the people who went to AMO, there was no direct connection with COVID-19. But we closed at the suggestion of HAB. And we hope to reopen Easter Sunday if all goes well. But again, we don't know, so stay with us. But last night, as I was researching or getting prepared for today's talk, I've been looking at SCMP headlines and so on. And one thing caught me, and I didn't cry because before, when it was statistics, it was, you hear about the numbers. We hit 1 million mark. But last night, somebody we knew, a close friend of Asia Society, Hong Kong, passed away. She was the former Philippine Consul General, Bernatita Catala, who became after leaving us 2017, she became the ambassador, Philippine ambassador to Lebanon. And we found out last night she passed away at 62 in Lebanon. And so it had to hit home. Before, it was all numbers. I was telling my friends and colleagues, I did not know anyone directly with COVID-19. But last night, hearing that news really touched us. So we want to send our condolences to Consul General or Ambassador Catala's family, and also our condolences to the Philippine Consul General. We will be doing that later on today. But on that note, I want to thank you all for joining us, and come back next week when we will have Professor Jessica Mannings with us on episode 9, and we will continue this series because we're close, but we are still keeping busy, and we want to keep you informed. And please keep the questions coming, and let's stick this. We need to go through this together. Very much, the tagline is "In this together," here in Hong Kong, as well as our Asia Society Global Center, and what's happening around the world. We really, truly are in this together. So thank you for joining us this morning. And again, thank you, Professor Leung.
Thank you.